When a loved one is nearing the end of their journey with stage 4 pancreatic cancer, it can feel like navigating an unfamiliar and emotional landscape. Hello, I'm Dr. James, and today I want to talk with you, the brave pancreatic cancer warriors and their families, about what to expect in the final days. It's a subject that can be difficult to approach, but understanding it can replace fear with peace and allow us to be truly present for those we love. This is a conversation about dignity, about comfort, and about love. The body, in its incredible wisdom, begins to prepare for its final transition by conserving energy. This is a natural and expected part of the process. You may notice your loved ones sleeping much more than they are awake, often for long, uninterrupted periods. This isn't just ordinary tiredness, it's a profound state of rest. This deep fatigue is the body's way of redirecting its limited resources away from daily activities and towards the essential work of letting go. It's a protective mechanism, a gentle shutdown that prioritizes peace over exertion. Trying to wake them or urging them to stay active can be disruptive to this process. Instead, sitting with them in the quiet, holding their hand, or simply being a calm presence in the room can be the most comforting gift you can give. Remember that even in sleep, they can often feel your presence and hear your voice. As the body conserves energy, the need for food and water naturally diminishes. It can be one of the most difficult changes for families to accept, as we so often associate providing food with giving love and care. You will likely see a significant decrease in appetite. Your loved one might refuse meals they once enjoyed, or take only a few small sips of liquid. This is not because they are giving up, but because their digestive system is slowing down and can no longer process food and fluids as it once did. Forcing them to eat or drink can actually cause discomfort, leading to nausea or bloating. The focus now shifts from nourishment to comfort. Offering small ice chips, a moist sponge for their lips, or a tiny bit of their favorite drink, if they desire it, is a way to provide care without causing distress. It's a shift in how we show love, moving from feeding the body to soothing the spirit. You may also observe changes in your loved one's breathing. This is a very common and normal part of the end-of-life process. Their breathing might become shallow, or you might notice irregular patterns, with periods of rapid breaths, followed by pauses. Sometimes, there might be a rattling sound, often called a death rattle. This sound can be alarming, but it is important to know that it is generally not a source of distress for the person. It is caused by the relaxation of throat muscles and the accumulation of secretions that they are no longer able to clear. The medical team can often help position your loved one or provide medication to reduce this sound. But the most important thing for you to know is that it is a peaceful, albeit unfamiliar, part of this transition. It signifies a deep state of relaxation as the body prepares to shut down. Another physical change you might see is related to circulation. As the heart works less efficiently, blood flow to the extremities is reduced. You may notice that your loved one's hands and feet feel cool to the touch. Their skin, particularly on the arms, legs and feet, might take on a pale, bluish, or mottled appearance. This is a gentle and natural sign that the body's systems are slowing down. Keeping them comfortable with a soft, warm blanket is a wonderful gesture of care. This is not a time for electric blankets or heating pads, as their skin can be very delicate. Simply the warmth of a light covering, or your own gentle touch, is enough. These physical signs are indicators of a peaceful progression, not of pain or suffering. As the body's systems continue to slow, you might notice changes in your loved one's awareness. They may become confused about where they are, who is with them, or what time it is. Restlessness is also common. They might fidget with their blankets or make repetitive motions. At other times, they may become very quiet and unresponsive, communicating very little or not at all. This can be difficult, as it feels like the person you know is slipping away. But this is a normal part of the brain's shutdown process. It's helpful to speak to them in a calm, reassuring voice. Tell them who you are, that they are safe, and that you are there with them. Even if they cannot respond, hearing a familiar, loving voice can bring immense comfort. These moments are not about having a clear conversation, but about providing a steady, loving presence in their final hours. Throughout this entire time, the primary focus of the medical team, and for all of us, is ensuring your loved one is comfortable. Pain management becomes the highest priority. The team will work tirelessly to manage any discomfort, often using medications that are administered in a way that is easy for the body to receive, even when swallowing is no longer possible. Please do not be afraid of these medications. The goal is not to hasten the end, but to ensure the journey there is as peaceful and pain-free as possible. You are your loved one's greatest advocate. Speak openly with the medical team about what you are observing. If you believe your loved one is in any discomfort, let the team know immediately. Ensuring comfort is the most profound act of service you can offer them now. In these final days, the emotional and spiritual needs of both the patient and the family often become more pronounced. This can be a time of deep reflection, of seeking forgiveness, or of sharing final words of love. For the person nearing the end of life, there may be a desire to resolve old issues or to simply be reassured that their life had meaning. For families, it is a time to come together, to support one another, and to honor the life that is drawing to a close. Do not be afraid to talk, to pray, to play their favorite music, or to simply sit in shared silence. These are the moments that create a sacred space for a peaceful transition. Your presence and your love are the most powerful forms of spiritual and emotional support you can offer. So many families we work with, especially our pancreatic cancer warriors, share stories of incredibly meaningful final moments. These are not always dramatic or movie-like. More often, they are moments of profound peace. It might be a final brief moment of clarity, a shared look, a gentle hand squeeze, or a quiet, peaceful passing in their sleep. These final connections are deeply personal and cherished. Many report feeling a sense of calm in the room as their loved one lets go. These moments, however small they may seem, become a lasting source of comfort for those who remain, a final gift of love and peace from the person who is departing. Understanding these natural stages can significantly reduce the fear and anxiety that so often surrounds the end of life. When we know what to expect, we can be less afraid of the physical changes and more attuned to the emotional and spiritual needs of the moment. It allows us to shift our focus from fixing to being. Being present, being calm, and being a source of unconditional love is the most important role you can play. In the end, it is not the medical details that will be remembered most vividly. It is the love, the comfort, and the dignity you provided. Your presence is the most powerful gift you can give, and it is more than enough.